Imagine this. You go to bed feeling completely fine. No chest pain, no dizziness, absolutely no warning signs. But while you're peacefully dreaming, your brain could be silently suffocating. Welcome to this explainer. Today, we're diving into a medical mystery about our nightly habits that almost nobody is talking about. How the exact angle of your neck while you sleep could be a massive hidden danger. It sounds terrifying, right? But we really have to ask, could the way you sleep actively increase your risk of a stroke? What I'm about to share with you is absolutely crucial, because this restriction of oxygen to your brain, it might not be from a disease or a medication. It could literally be happening just because of how your neck and spine are positioned when you close your eyes. So here's the thing. This silent threat has absolutely nothing to do with your typical heart health advice. I mean, we all know the drill with diet and exercise, right? But I bet your doctor has never once asked about the structural position of your spine during a checkup. The reality is, the direction your body faces actively changes how well blood gets to your brain for 7 or 8 hours every single night. Part 1. The agitation. How aging changes sleep dynamics. Look, when you're in your 20s, your blood vessels are basically like elastic bands. They stretch, they adapt. If you sleep in some weird, twisted position, your body just quietly corrects for it. You maybe wake up with a stiff neck, but that's about it. But as we cross into our 60s, those arterial walls start to stiffen up. The tiny vessels feeding your brain become way less flexible, and suddenly the pressure inside your skull gets incredibly sensitive to changes in how you're lying down. Normally, a healthy cardiovascular system experiences a 10 to 20% drop in blood pressure while you sleep. Doctors call this overnight blood pressure dipping. It's incredibly protective. It's basically your heart taking a much-needed vacation. But if you're stuck in the wrong sleep position, compressing the wrong blood vessels or airways, that natural, highly protective dip, it gets completely wiped out. And missing that dip leads straight to a condition called nocturnal hypertension. The data on this is honestly startling. Clinical studies show that if you have nocturnal hypertension, meaning your blood pressure stays high or even spikes while you're asleep, it is linked to a massive 2.65-fold higher risk of stroke. That is a huge hidden risk factor just playing out in the dark. So let's look at section 2, the hidden dangers of flat and stomach sleeping. Let's start with sleeping perfectly flat on your back, zero elevation. It sounds like the holy grail for your spine, right? Well, here's what nobody tells you. When you lie completely flat, especially as you get older, you lose gravity's help. Cerebrospinal fluid can actually pool up, slowly creeping your intracranial pressure higher and higher. The symptom most people completely misunderstand is waking up at 3 a.m. with this dull, heavy throbbing right behind the eyes. It feels like a localized pressure cooker. You might just write it off as getting older, but it's very often your brain desperately signaling that the pressure inside your skull is way too high. Which brings us to supine hypertension. This is a dangerous spike in blood pressure triggered specifically by lying flat. For some older adults, just lying down horizontally forces the heart to work overtime because major vessels like the aorta can actually get slightly compressed. Your body starts fighting against that lack of gravity just to move blood around, which spikes your pressure right when it's supposed to be dropping. Now, what about stomach sleeping? I want you to think of this position like a kinked garden hose. When you sleep on your stomach, you obviously can't breathe straight into the mattress, so you have to rotate your neck, sometimes a full 90 degrees to one side. While running right along your cervical spine are 2 vital vertebral arteries to carry blood straight to your brainstem. Twisting your neck like that for 8 solid hours, you are essentially kinking those arteries, starving your brain of optimal blood flow all night long. And to make matters worse, both flat back and stomach sleeping seriously mess with your breathing. As we age, our airways naturally become more collapsible and our muscle reflexes slow down during sleep. If you're flat on your back, gravity pulls that airway closed, leading to severe positional obstructive sleep apnea, or POSA. And if you're on your stomach, your entire body weight is basically squishing your rib cage and lungs right into the mattress. That plummets the amount of oxygen your blood gets with every single breath. Let's move to section 3. The solution, optimal positions for your brain and heart health. Okay, this is one of the most exciting discoveries in recent sleep science, the Glymphatic System. You can think of it as your brain's overnight janitorial crew. During deep sleep, cerebrospinal fluid literally washes through your brain, flushing out metabolic waste, including those amyloid beta proteins that are so strongly linked to Alzheimer's disease. And guess what? Research proves this crucial deep cleaning process works best when you are sleeping on your side. The data from the American Heart Association and Live Hospital makes this so clear. Sleeping flat on your back or prone on your stomach, that just worsens apnea, compresses your lungs, and kinks your arteries. Now, the right side is actually recommended for certain heart failure patients to help reduce heart pressure. But for the vast majority of us who just want optimal brain clearance and solid circulation, sleeping on your left side or on your back with your head elevated are the absolute clear winners. So why the left side specifically? Well, your heart sits just a little left of center. But more importantly, one of your body's biggest veins, the inferior vena cava, runs right down the right side of your spine. Sleeping on your left side keeps your body weight from squishing this massive vein. That allows deoxygenated blood from your lower body to flow back to your heart freely and easily. It literally unpinches your entire circulation system. But I hear you. What if you just can't sleep on your side? Maybe you have bad shoulders or hip pain. Don't worry, the math gives us a surprisingly perfect fix. 15 degrees. Simply elevating your upper body by a gentle 15 to 30 degrees completely changes the physics of your sleep. By using a wedge pillow or maybe an adjustable bed to get that 15 to 30 degree lift and tossing a small pillow right under your knees, you create what researchers call the zero gravity posture. It is a brilliant little setup. It uses gravity to actually help your blood flow. It keeps your airways wide open to fight off sleep apnea, maintains the natural curve of your lower back, and instantly relieves that dangerous head pressure and supine hypertension we were talking about earlier. Which brings us to our final section, actionable adjustments you can make tonight. Let's talk tools first. A medium firm mattress is a must to keep you from slumping. You'll want a pillow that perfectly aligns your neck because again, we absolutely have to avoid that severe neck bend. If you're trying to train yourself to become a side sleeper, body pillows are a game changer for keeping you from rolling onto your back. But timing is just as important. Eating a huge meal right before bed sends all your blood down to your gut, literally stealing it from your brain. And late night alcohol, it acts as a vasodilator. Your blood pressure crashes, then severely spikes in this crazy vascular yo-yo. It makes bad sleep posture so much more dangerous. So try to stop eating about 3 hours before bed and cut off the alcohol 4 to 5 hours before you sleep. I really love this incredibly empowering quote from Dr. Rachel Salas, a sleep neurologist over at Johns Hopkins. She says, "Only you can make sleep a priority. Nobody else can do that for you." And it's so true. Doctors can give us the science, and we can map out all the vascular mechanics here. But the actual healing, that happens in your own bedroom, driven by the choices you make. So, here is the thought I want you to carry into tonight. Listen to your body. Seriously pay attention to how you feel when you wake up in the morning. Are you waking up with headaches? Do you feel weirdly exhausted? When you turn off the lights tonight and settle into your mattress, I want you to ask yourself, are you actually giving your brain and your heart the overnight recovery they truly deserve?